This episode contains content related to suicide, self-harm, other mental health disorders. And if you or someone you know are struggling with any of these disorders, know that you can call a crisis hotline at 988. And that's available to call, text, or even chat online if you need help.
Welcome to Independent RX Forum with the National Community Pharmacists Association, America's leading advocate and business education provider for independent community pharmacists. Independent RX Forum is powered by RX Connection.
Hello and welcome to Independent RX Forum, the official podcast of NCPA. We're glad you could join us. I'm your host, John Beckner. Today's conversation will center around mental health, specifically the role of the pharmacist in mental health care. And my guest is Hannah Fish. Hannah is Senior Director of Strategic Initiatives for NCPA. Hannah, it's great to have you here.
Love being here.
So there was a time not too long ago when mental health issues were not discussed, and there was probably a stigma around even talking about it.
Absolutely.
But, things have changed. I think you could argue that public health awareness or consciousness has never been higher about mental health issues. I saw a recent statistic that said 1 in 5 adults experience a mental health illness sometime during the year. So pharmacists would seem to be in a really unique position to be able to help their patients that are having mental health challenges. Can you talk a little bit about that?
Yeah, absolutely. And I think to that point about the stigma and the conversation and awareness too, I think COVID really kind of opened the doors to that. People became more open about the things that they were experiencing. Social media certainly has opened the doors to people being more open and honest about the conversations as well. But with pharmacy and pharmacists being active in their communities and serving generations of families, they know what's going on in their patients' lives. So they know when something happens or when there are challenges that are being faced. They know the hardships of the community. And so because of those relationships, because of that knowledge, pharmacists are uniquely positioned to be essentially hyper aware of what might be risk factors or triggers for things that could contribute to mental health disorders.
COVID really shone a very bright light on a lot of things, and certainly the capabilities of not only pharmacists, but really pharmacy teams.
Yes, absolutely. And I think that is a really good point to call out too, because when you think about our technicians and those especially that are being trained as community health workers, they're the ones that are sometimes interacting with our patients even more prevalently than the pharmacists sometimes. So even technicians and team members are going to be an incredible advocate for mental health awareness in the pharmacy.
That's a great point, because I think technicians oftentimes are the first person the patient comes in contact with.
Exactly.
So really in a great position to be able to help or refer to the pharmacist for additional assistance. So, I mentioned in the beginning that there's oftentimes or has been a stigma attached to mental health. As a pharmacist, as a practitioner, how important is it to try to, I guess, destigmatize or normalize those conversations with these patients?
Absolutely. It's incredibly important to work on destigmatizing our conversations around mental health. There's been so much in media that has contributed to the perception of mental health disorders, but knowing how common and prevalent things are, it's something that we should be working on to change our vernacular and our verbiage and how we're presenting. And one of the things that I think the entire healthcare community is starting to get around and behind is the patient-centered language and patient-first language. So when we talk about patients with diabetes, we don't really say they're a diabetic anymore. We should be moving away from that. So when we're talking about patients with mental health disorders, we don't call them psycho or schizo, anything like that. It's a person with a psychiatric disorder. It's a person with schizophrenia. It's a person with anxiety. And I think that is what we can do to help contribute to the destigmatization of mental health disorders.
And when we talk about mental health and mental health challenges, you see lots of patients every day, and these challenges can really run the gamut.
Yes, absolutely. And, mental health disorders very much veer from a acute condition, something that happens maybe once and is very situational.
Right.
Some things are related to trauma, and trauma comes in various forms. In natural disasters, a tornado hits, a hurricane hits, that causes someone to lose their house. That's a traumatic experience for someone. It's not always some of the most common traumatic things that I think people come to mind. And then you keep going along the spectrum, and you've got psychosis type disorders where people are experiencing hallucinations and it's affecting their agency over their lives. So there's really this gamut, as you said, of how people are functioning and trying to function in everyday life and what they're living with and what they're carrying. And so being able to support them and help them through that is key in healthcare.
Right. And when I think about independent pharmacy, independent pharmacist, we pride ourselves on getting to know our patients.
Yes.
And I think that puts us in maybe an even better position to be able to assist.
Oh,
because
absolutely.
we've taken the time to get to know them.
100%. And when, Susie's graduating from college, that's going to be a transition for them, and
right.
the challenges that come from moving away from home and, whatever that support system might be, or,
right.
When someone loses a spouse or a child or anyone in their life. And so just knowing that you can be there for them, not only from a pharmaceutical standpoint and helping them with medications that they might need to help through whatever those challenges might be, but also being that community resource. Where you can refer people to, the church groups, the community events that you can let people know where they can find support.
Yep, 100%. So you've been intimately involved in something called mental health first aid.
Yes.
In fact, I think you're a certified mental health instructor.
Yes.
Talk about how you got involved in that. You've been an NCPA for how long?
I'm just over 8 years now.
Okay. Wow.
Yeah. That's I know, right?
Hard
Time
to
flies.
believe. So I'm not sure when you got involved, but it was a number of years ago. Talk about why you got involved, what that's been like, and then maybe we can talk a little bit about the ins and outs of what's involved in that training.
Yeah, I would love to. So I'm very grateful that my predecessor, before I joined NCPA, had already started on the journey of getting pharmacists aware of mental health first aid training and starting to get more pharmacists to be trained instructors so that they could train others in their community. And pretty much right as my predecessor was leaving, I came on board and kind of picked up that project work that we were doing. We got a grant to create pharmacy specific cases that would be relevant to the mental health first aid training. We had pharmacists get scholarships to go through the training and are now being instructors and training others across the country. And as part of that, I then took the mental health first aid training course. And I just fell in love with it because it was such a practical set of skills that I learned. And as someone personally who has suffered from various mental health disorders across my lifetime, it just kind of was this, this language, this world that I wish other people had and knew about and could have that safe space to talk to others about the challenges that they were dealing with and how things have worked or not worked and what they've done to support others. And so I became enamored with that to the point where I wanted to then be able to also train other people in mental health first aid because I thought it was so important. And I thought the skill sets were so transferable to literally everyday life.
Well, that's pretty powerful. And it sounds to me like being an instructor, going through that mental health first aid training helped you in your mental health journey?
Oh, absolutely. I finally learned terms that I could put to things. I realized some of the phrases people use, some of the, you know, sympathies that people say, or even some of the stigmatizing things, the, you know, like pull yourself up, rub some dirt in it, keep going on in your life. And depression doesn't work that way, right?
Sure.
It doesn't matter if it's a sunny day outside and you should be able to be happy and smiling because it's sunny. Like, literally, these disorders don't care what the weather is.
Exactly. That's well said.
And so, you know, being able to help other people recognize when they say those things of how can you be so sad it's sunny out, figuring out a way to rephrase that, because the intention is usually there to say, you know, I care about you. I want to support you. How can I help you? And being able to introduce those phrases and make you rethink kind of the, you know, the cliches and the platitudes that people say all the time and how they actually might hit wrong for people that have mental health disorders. That's what I really like about the course.
So it really does make a difference if you're as a provider, as a practitioner,
Absolutely.
if you're able to put yourself in their shoes, you can be
100%.
much more effective.
Yeah. And I will say that one of the things that is stressed in the mental health first aid course too is that recognition that you can't actually put yourself in someone's shoes. And you try to learn the empathy, you try to learn about the things that someone might be experiencing, but it's also so important to not compare or to say, I know exactly what you're going through. Because just because you and I both have anxiety, for example,
Yep.
doesn't mean that your anxiety shows up the same way my anxiety shows up. So to say, you know, I did this, I know exactly how you're feeling, I went to see a therapist, that might not actually work for me.
Right.
And for someone else. So understanding how different things present, how different people handle their mental health disorders and their symptoms of it, and what might be best for them is something that the course really emphasizes and really captures kind of all of the options that you could convey to someone who might need some support.
So are you going to continue teaching the course?
I'm definitely going to continue teaching the course. I think I've taught over 15 courses and more than 150 pharmacists and techs at this point.
Amazing.
So it's so rewarding to hear their stories. And I learn something every time I've talked to someone else that shares and feels open and has the space to share their own journeys. And it's incredible the number of people that have gone through the course that have either directly been impacted by some sort of mental health disorder or are caregivers for someone. And it's so rewarding to be able to continue teaching people and giving them the language and that terminology and the tools that they need to help someone else not experience something or have more support through their journey.
Right. So talk about the details. Is there I know there's a live or virtual component. Is there also a self-study that's part of it?
Yeah.
Well?
So the mental health first aid training course actually originated in Australia. And it came over to the United States about 15 years or so ago and is actually adapted for like 25 different countries at this point, maybe more and growing. Right. And it's offered by the National Council for Wellbeing. And so they're the ones that administer kind of the program. So other people can get certified and trained. There's hundreds of different instructors all over the country that can teach the course. But the impetus of the course really is almost to create a first aid like approach to mental health challenges. So just like someone who knows CPR and basic life support, they're not the one necessarily treating or managing someone's mental health disorders with them. They're recognizing the signs and symptoms, realizing that someone might need additional help and acting essentially as a referral source to greater care.
Right.
And so the framework then of mental health first aid follows kind of a basic acronym. It's called ALGE. And each letter walks through the various kind of steps, if you will, that are involved in recognizing mental health challenges and getting people to get help. So can talk about the acronym and what it all stands for briefly, all of that. So our ALGE is ALGEE, and the A is twofold. It's both our awareness and our assessment of if anyone is at a severe risk of suicide or harm. So we want to make sure that we're assessing for like the immediate crisis. Do we think this person is in immediate danger? And if not, then it becomes this awareness and approach. So how do I engage you? How do I start a difficult conversation? How do I start an awkward conversation that we're not still really used to having?
Yeah, I can't imagine anything more awkward than maybe talking to somebody about suicide.
Oh, yes, absolutely. And that's one of the things that we do go over in the course is we actually practice asking people those questions.
So there's a lot of role playing that's part of it then.
Yes, it's very interactive, very engaging, and there's a lot of gray area where we have discussions where some people might think one approach is a good approach and another person says, no, I don't think that would actually work for me. But it is allowing that space to say, here's why I think it would or why it wouldn't, and then creates these good and bad examples that you can integrate for your own use. So that's A. A is our awareness approach and assessment for risk of suicide and harm. Then our L is listening non-judgmentally. So much easier said than done. But it's really important sometimes with people that are experiencing mental health disorders or challenges that they don't always need help. They just need to feel heard and understood and recognized. So being able to be reminded of basic listening skills. It sounds so simple, but
that could help with a lot of things.
Oh, absolutely. You don't realize how distracted you are on your phone all the time and how much eye contact could potentially make the difference, but also culturally recognizing where things like eye contact actually might not be appropriate. So we go over the cultural implications of mental health disorders and challenges of listening and talking with others too. So,
fascinating.
Yeah. Our G then is give reassurance and information. So we like to call that hope with facts. One of the big things we emphasize in the mental health first aid training is around the idea of recovery, that just because you experience a mental health challenge or a disorder doesn't mean that that is something that sticks with you for your lifetime.
That would seem to be a really important thing to convey to somebody.
Absolutely. Especially people with depression or anxiety, someone who might experience a panic attack, again, being very situational. Doesn't mean that they're going to have panic disorder necessarily. It doesn't mean that they are going to be depressed for the rest of their life. And so our giving reassurance and information is really trying to instill that, yes, right now you might be experiencing something that feels profound and overwhelming and uncomfortable, but there is hope that you don't always have to feel this way. And there are things that, you can do that will hopefully make you feel better. And this is a finite period of time. We don't know necessarily what that timeline always is, but trying to instill them with that hope and giving them information that they're not alone, that they're not the only one feeling that way, that other people have experienced what they're experiencing. So that one's a really important part of the course. Yeah.
So keep going.
All right. So my E's, I love it. So our E's actually stand for encouraging professional help and then encouraging self-help.
Okay.
And so we go over the various healthcare providers that can be referred to, which I think is very important. And what's really interesting about the course is that pharmacists aren't specifically mentioned. And so I always try to integrate into the conversation, where do you think pharmacists fit on this spectrum? Because medications are part of the conversation around professional help. But as far as a provider, pharmacists aren't listed. And so we have that kind of debate to say, where should where should we fall? And I personally think that we can provide professional help, but I also recognize where we need to refer to someone for diagnosis and
know when to do that. Yeah,
exactly. But then on the back end, if someone does receive that diagnosis, we can then help manage their medications and, again, referral to other community sources.
Yeah.
So the encouraging self-help then is encouraging things like yoga or breathing and meditation, some hobbies, etc. So we go over some different examples of how we can encourage that.
So it sounds like just a terrific course. How often is it offered?
Yeah, great question. So it is offered literally daily across the country. And if you go to the mental health first aid website, you can look up any courses that are offered in your community.
Right.
From NCPA standpoint and, our schedule and when we offer it, we try to offer it several times a year. We just, our last course that we offered was back in April, I think. And we're going to have more courses posted shortly here. So check back frequently to the NCPA website. But if you're looking to get trained right away, check out what's available in your community that you could potentially engage with right away.
It sounds like it's readily available.
Yes.
Yeah. So one thing I wanted to explore with you is not only is it important for pharmacists and pharmacy teams to recognize when a patient may be having a problem, but what about peers and colleagues? How important is that?
Incredibly important. We live in such a high stress, high demand, high productivity world these days. And the expectations of people are just so different than what they used to be. Despite how young I might look, John, I do remember the days before cell phones were a thing.
Do you really?
I do. I remember cassette tapes too and dial-up internet. So,
but you don't remember VHS tapes.
Oh, I definitely remember VHS tapes. The number of Disney movies that got watched, John. But no, so I just remember that pace of being a kid in free spirit, and it was go out and run around in the neighborhood in the backyard. And I'm not necessarily saying that all of the technology is the only thing that is contributing to that, but it's been such an exacerbating exponential factor, I think, in our stress of the world. And so recognizing that our patients are experiencing that, but also the demands on us at work and in our personal lives that we're never shutting off anymore.
Right.
And that time to play and be free to explore and create is just not happening like it used to. So being able to have these skill sets, to be able to have these conversations with your coworkers, albeit, check with your HR and all the things.
Yeah, but again, I think it's important for colleagues to know that other colleagues care about them.
Correct. Absolutely.
And are in a position to help if they want it.
Absolutely. And the skill sets that you learn in mental health first aid are, like I said, transferable. They very much can be used in conversations with parents, children, coworkers, patients. And I, quite frankly, use the skills that I learned in my mental health first aid training and then continuing to be reminded of as an instructor. I use the things daily.
Well, I mean, I really, the point you made about them being transferable really resonated with me because, again, I know we're going to be recording a future podcast on vaccines.
Yes.
And certainly from a communication and vaccine hesitancy standpoint, those skills are really, really important.
Yeah, absolutely. It's a matter of being curious and going back to the listening non-judgmentally is not just coming to these conclusions or assuming that you know what someone's experiencing. Yes, we have all of this medical knowledge and we're discerning that and we are trying to help our patients, help them live their best lives. But at the same point, we have to know where they're coming from and we need to be curious about what they're experiencing. And I think one of the things I also really love about the mental health first aid course is how much we acknowledge the feeling that someone has and not so much the behaviors or the actions that people might exhibit. So one of the things we talk about too is non-suicidal self-injury. So a lot of people think of like cutting or burning or bruising type things. And we really stress the fact that you shouldn't really come at someone to say, oh my gosh, how are you cutting yourself? Like, how could you possibly do something like that?
Right.
That's terrible. And you say, wow, you must be feeling some deep things right now. Can you tell me about what you're feeling and why you feel the need to do this to yourself? Right. So you're not judging the action.
Sure.
You're drilling down into the feeling.
Okay. So I'm a pharmacy owner.
Yes.
Okay. And I try to implement differentiated services, and I decide after listening to this podcast that I want to implement mental health services in my pharmacy.
Yeah.
What's the best way to integrate this? How do you operationalize it? We always talk about being able to operationalize services. How would you operationalize something like this?
Yeah, I know that's always the challenge, right? Like, how do I do this? It sounds great, but what do I actually do? So first thing is please sign up for a mental health first aid course.
Good first step, right?
Easy, basic skills, and good conversations and learning from other people's experiences to just be more empathetic towards these individuals. The other things that you can start doing is, as pharmacists, and we kind of say this for almost every patient that we serve, we know what medications they're taking. Yeah. We know if someone's on an SSRI or, any of the antipsychotic medications that they're taking, et cetera. So run a list of your patients that are on Zoloft or, Lexapro, whatever they might be on, and make sure that you're checking in with them. Hey, how are you doing? How's life this month?
Idea.
And be more curious to the answer of someone that says, oh, I'm fine, right? Like there's usually something more under the I'm fine or I'm okay. Like start to listen for those cues and do those assessments.
So the mental health first aid training, I think I know the answer, but I want to make sure you articulate it. It's open to technicians as well.
Yes. And so that's one of the unique things that NCPA offers is by taking the course with us, we offer continuing education credit. So it's not blanketly available for CE purposes. If you take it with someone in your community, you can certainly ask your state board or locale for the credits, but NCPA specifically offers that pathway for CE.
Okay.
Yeah.
Any other thoughts about operationalizing it? Take the training, other things to integrate in the pharmacy that folks should be aware of?
Yeah, absolutely. So take the training, look and do a kind of audit of your patients that are taking typical medications associated with mental health disorders. And then one of the things that I find really exciting that some of our pharmacies and members are already doing is using the PHQ-9 and the GAD-7 tools in their pharmacies to assess and monitor for anxiety and depression. So the PHQ-9 is a 9-question questionnaire that's really simple that kind of evaluates how someone is dealing with their depression. And then the GAD-7 is for anxiety. And, whether you have a new patient or someone is newly added to a medication for mental health disorders, use that as your check-in to help with that med management. With the, I guess, dearth of mental health providers that are out there, some people might see a provider once, and not have another appointment for 6 months. Hopefully they're seeing them more frequently. But if you're the pharmacist that is seeing them once a month now, can you actually be the person to check in on that baseline? Is that depression getting worse or better? And where do we might need dose adjustments? Because we know it takes 4 to 6 weeks for a lot of these medications to kick in. And then from there, it's still very much kind of a trial and error space. I know we're getting more involved with some genetic testing, which if you really want to advance in the operation, start looking at genetic testing for medications around the mental health disorders. But really, integrating those assessments is another kind of easy step to hopefully bring into that call. And whether it's on your med sync call or a patient intake form, or having all of your patients maybe fill that out at the beginning of each year when they switch insurance companies.
Great idea.
All easy ways to start integrating this.
Yeah, so it sounds like pharmacists, like in a lot of other areas, can really be an important gap filler in between physician visits.
Yeah. And I guess one more thing too is don't be afraid to put a sign up somewhere on your counter or somewhere visible to patients that say, do you have questions about mental health? Or, list some of the things, depression, anxiety, like put those things out there and make sure people know that they can talk to you about it. So if you don't display it for them, they might not know. So start asking the questions, start putting that information out there so people can see it.
Don't assume.
Yeah, exactly.
So Hannah, we've covered a lot of ground.
Yes, we have
today. Anything else that you want to mention or talk about that we've not touched on?
Yeah. I think the one thing that I want to leave people with, and I briefly mentioned it before, but we have no idea what people are carrying when it comes to mental health. We know when someone breaks their leg. We often know when someone is diagnosed with cancer, and our initial reactions to that is usually, oh my gosh, what happened? Or here, let me get the door for you. Or how can I support you with this? Mental health disorders and other things like grief are, quite frankly, happening in the dark. And so being open to asking those questions and checking in on people, and then realizing the sometimes uphill battles people are facing on a daily basis. And, I can speak from personal experience. I mentioned I've had anxiety and bouts of depression throughout my life, but I was recently widowed 2 years ago, and I've been carrying grief for these 2 years. So the fact that I'm sitting here talking to you on a podcast feels absolutely incredible to me, and also very surreal. Like, I'm living with grief on a daily basis, and people in society don't understand grief very well. And they think that, 2 weeks after the funeral, right, you should be right as rain, and it's, get back to producing and being a productive member of society. But grief is such a different animal in the mental health space. So just ask questions and be empathetic and care about people.
Well, I can't, it's hard for me to imagine what you have had to deal with, but I just want to thank you for your openness, your transparency about the challenges that you've had, not only with your recent grief, but other things that happened before. But I think this is a pretty powerful message that you've been able to convey, and I want to thank you very much.
Thanks, John. And I want others. Obviously, I have this mentality to teach people otherwise with mental health first aid, and I was teaching that course before I lost my husband, and I think there's these misconceptions, or there's these norms that no one has challenged. And to be able to share and be open, I feel like that's the only way we're going to make changes in the world and make people feel heard and understood. So I hate that I have to be the one to do that, or feel like I have to be the one to do that. But I, at the same time, feel like it's such an important message to share with others, because how will anything change if not?
Yeah. Well, I want to reach over and give you a hug.
We'll bump the microphones.
Right. But thanks again for being on today.
Yeah, thanks,
Appreciate
John.
it.
Thanks for asking the questions.
Yep. And thanks to everybody for tuning in to Independent RX Forum. We encourage you to listen on whatever medium you listen to your podcast.